I believe I think the public is more aware um, than people may give them credit for. I think they're very aware of the drug problem. They see it, they hear it, they know people that are getting arrested or that have addiction problems. I think my response to that is one thing that the public may not know as a avenue of enforcement, and something that we have done successfully in the Dells, is to target the doctors. There is a problem when we have doctors that are dispensing large quantities of Oxycontin and oxycodone. One particular girl that we arrested a couple years ago was on 32 pills a day, and the same
prescribed.
And this was the same doctor that we were hearing from the people that we were arresting, because we were working in an oxycodone case where there were an oxycontin case where there were multiple people involved. They were all the same source was that doctor. So I think I owe it to those people who have an addiction problem and the people that are potentially going to be buyers and people are affected by the drug problem, is to question, why is that doctor dispensing such a large quantity? I've spoken to my own personal doctor, who was a member of the same clinic, same medical protocol, which was St. Clair Hospital. And I say, without naming names, are there other alternatives? Educate me. Are there other alternatives to OxyContin and oxycodone? And he said yes, but it's not being explored as aggressively as it could.
Has the doctor been taken into custody by
No.
the Wisconsin Dells as a result of this?
Not at all. The doctor was asked regarding the specific cases that we had, regarding the amount of drugs that they were on, because one of the problems was that those drugs were now dispensed for sale. I think I owe it to that doctor to let that doctor know that the prescriptions that they were providing were not used in accordance with how they were intending to provide them to. But then we also talked to the DEA about the problems that we're having. The DEA said that, well, there are other things that can be done, and the DEA conducted audits. And the DEA, in cooperation with our department, provided some training, provided a little bit of concern to these doctors, and medical protocol was changed. Now the dispensing of some of these pain-killing drugs that are having a big issue in our area have been curbed, and we're proud of that. Am I second-guessing a doctor? Mm-hmm. No, I am doing a drug investigation. There have been several doctors that I have spoken to when we find that their patients are not ingesting the drugs that they are intending to ingest for their alleged medical issues.
So we talk about going after doctors. That doesn't mean you're rounding them up and throwing them in jail.
No.
But was 32 pills a day medically legitimate? Is that what you found? Understanding that there were alternatives.
In this case,
prescription legitimate itself.
No, she admitted to us that she continued to fake a injury in order to receive and to expand upon her pain to the doctors in order to increase her prescription rate. You can buy, on our streets today, you can buy heroin a lot more easy than you can buy meth. And I see it by working with my drug officers, my drug unit. We hear it by talking to our informants. Last week, I was talking to an informant. Where can I buy meth? Ooh, I'd have to go to Madison for that, and it would be tough. What about heroin? I can make a phone call.
Well, isn't it? But I guess we should probably change topics. But I mean, meth was supposed to be great for people because it was so portable. I mean, you can make meth in the trunk of a car, right? It was not one of its big things, but you can't get it. People just aren't making it.
No,
because the supply, the products to make it are limited now.
Right. The supply and I think also the demand, because now without the, it's true that a lot of those pain-killing drugs that will springboard into other things, heroin is another one.